This was the scene outside the Randall-Phillips Polyclinic on July 22nd. Staff and patients were evacuated from the building and fire officials responded following an environmental issue, an odor believed to be due to a gas leak, which caused the clinic to close. However, come Monday morning, it will reopen its doors to welcome patients for the first time in 5 weeks. Ahead of its reopening, Health Minister Lieutenant Colonel Jeffrey Bostic toured the clinic and updated the media on the work done to remedy the issue.
We then had to solicit the assistance of the Ministry of Energy and Water Resources to check all of the sewage lines for one, and all of the drainage systems and so on. And they were able then to detect where we had some stagnation in the system, and also where in some cases there was traces of old engine oil into the system. So we had to do a lot of flushing out, a lot of cleaning out.
He noted that while the clinic would open at the usual 8:30, there would be a change to the closing time initially.
We will not have the service after 4:30 in order to facilitate the situation where we have all of the staff working in the polyclinic during that period of time, 8:30 to 4:30, to deal with the backlog of immunizations, the whole set of things that we would have had issues with over the last 5 weeks. And that is going to happen next week, and then we will revert back to the normal operating hours.
While the clinic was closed, as Acting Medical Officer of Health Dr. Joanne Paris explains, all efforts were made to ensure patients were not disadvantaged.
We did provide transportation for patients to the St. John Polyclinic, especially for the child health, the antenatal, postnatal, and the mental health services. We provided transportation for those patients to the David Thompson Polyclinic.
Minister Bostic thanked the public for their understanding during the closure. Lorna Jones, CBC News.